This one is also encouraging to me. First of all, with all due respect to Senator Feinstein, I think it's time to follow Barbara Boxer, who, in my opinion, better senator, to exit the scene. California, blue state. She will be primaried, and this is a primary opportunity. In California, they have jungle primaries, as they're called, where the top two vote getters go into a runoff. So you can have two Democrats win the primary for the senator. So this is a no cost, no danger, no spoiler primary opportunity. And I am hoping that there are candidates in California right now lining up to primary Senator Feinstein. Aside from, I think, her failures on the Judiciary Committee, aside from her failures on the Intelligence Committee, aside from where she gets a lot of her funding, here's a bit of a tin ear. Now, it's not what she's saying here about single payer is not quite as bad as it's been represented in print, but certainly she deserved these boos. Here it is. This is number 4.
My concern, I'm going to be retiring soon. My concern is Medicare and Social Security. But I'm also concerned about affordable care, health care. And I think the recent bill that was proposed was an abortion, to not do a pun, but I think it was ridiculous. So here's my question. There's going to be a proposal by Senator Sanders. Supposedly it's coming up later this month. It's basically single payer. I don't know the details of it. I've read how he feels about things, so I have an idea. And you probably don't know the details either.
I don't.
But my question is, how are you going to help support single payer? Because all the proposals and the reworks that have been coming up with healthcare right now basically are just helping the health insurance industry. People like me, people like our children, and the healthcare people who provide healthcare, the doctors and the medical facilities, the nurses, etc., are not getting any breaks. But the healthcare industry is getting all the breaks. So my question again, how are you going to help support single-payer healthcare?
Well, if single-payer healthcare is going to mean complete takeover by the government of all healthcare, I'm not there. If single-payer healthcare means trying to work out some of the problems that are existing. We've got an immediate problem that I learned about just coming up. It's a cost responsibility issue.
Okay, single payer doesn't mean either one of those two options that Dianne Feinstein just mentioned. It does not mean a total takeover of a government takeover of healthcare, as she said. She said, if single payer is that, then I'm not there. It's not that. No, it is a total takeover of the middleman insurance industry, which adds no value whatsoever to the delivery of healthcare. None. Zero, zilch, nada. It also doesn't just mean dealing with the cost sharing and fixing whatever that. It doesn't mean either one of those things. It means getting rid of an industry that does nothing. When Donald Trump last week threatened to cut back on the subsidies that are paid to insurance companies to make sure that people who can't afford health insurance get health insurance, and the Democrats then subsequently said, well, you may have a government shutdown if we don't put this into the budget to fund this stuff. One of the implications of that was really not really covered was that, wait a second, why is the government paying a third party to then pay for the health insurance, the health care for these people? Why doesn't the government just pay for the health insurance? Like, why does it have to simply go into someone else's pocket so they can take part of it out and pay the doctors? Why
Because
not
America.
Why not have the government just pay that to the doctors, to the providers? It laid bare the fact that the health insurance industry is a BS industry.
It's completely useless.
You can hire them to administer certain things, but like the interview that we had today with David Dianne, we talk about these pharmacy benefit managers who were originally supposed to help with paperwork and ended up basically creating an entire arbitrage business for themselves. You have another set of middlemen who don't provide any value add whatsoever. All they do is provide value for their shareholders and their board of directors and their CEOs. And that's it. At a increasing cost. And not only is their profit a cost, but their inefficiency in being able to negotiate because they don't represent as many buyers as a government program would, and they don't have the diminishment of risk that comes across having an entire population of a country covered. So it's absurd. Hey folks, Sam Seder here. Donald Trump can kiss all of our asses. And one way he can is by you subscribing to this channel. I don't know how that works.